MEC for Health, Ms. Sindiswa Gomba, is currently addressing or engaging the union here at Livingstone. This particular visit precedes the one of Nqonji, and if you'll recall, that was the first place to be identified as a quarantine zone. And there has been report that conditions there are very brutal and terrible for the people or the patients that are currently using the hospital. There has been so many issues that have arisen from that particular problem, with a number of staff members complaining that they do not have adequate PPE and that they fear that the rising numbers might result to some of them catching COVID-19 and saying that they really wish that something could be done with that situation. Some of the issues that have been highlighted or that were highlighted previously was the hectic shortage of staff members, with some staff members saying that they are now taking on more work or more duties than what they should, and saying that this is frustrating them. The workload is almost unbearable, with a number of patients being admitted there. There seems to be very much stress and the hospital remains very overwhelmed. But right now we are going to speak to one of the union members or representatives who will tell us what has transpired today and how does she feel about the outcomes of today's meeting. Ma'am, can you just tell us, what are some of the things or the key issues that have provoked or resulted to this meeting?
I think more than anything, it's the video. That's our observation, that the Skype video that was broadcasted internationally about the hospitals, the state of hospitals, specifically in our metro, that has exposed the weaknesses of the department and how the department is collapsing in the province, specifically also in our metro. So in our observation, we feel that the MEC is coming because of that. And we are hoping that by the end of this week, because we believe that she will be here by this week, there will be some outcomes that will assist, because this is what we've been saying as NEHAWU in the region, that let's work together. There is a crisis. No one needs to be bigger than anyone. Let's be a team, because it's our people who are affected, it's our brothers, it's our sisters, it's workers that are getting infected, that are dying. Like today, we lost 2 shop stewards, the chairperson of Livingstone as well as the shop steward here in Nqonji. So it is sad, and we appreciate this intervention. We are really hoping that it's going to come up with positive results, because we have been engaging. With no results, we've been resolving, no implementation. So the first session was with Nqonji. The second session is going to be with Livingstone and UBH, and we are not even happy with how this whole intervention has been coordinated, because we feel that all these institutions should have been in one room. We are dealing with metro, there are clinics, and for that matter, we are just coming here to attend this meeting. We were not told they wanted to meet with the branch leadership, but we said no. We want issues to be addressed at the level of the metro, not institutionally. We don't know the plan, but from the briefing that I'm hearing from the leadership that was here from Nqonji, as much as we appreciate the intervention, they are really not happy, because they feel that the interventions that are coming with the department are not informed, because they don't come to us. For example, practical example, 2 weeks ago, there was a call for intervention for the soldiers to come and assist in Dora. When you speak with the leadership in Dora, they will tell you that there are 16 of those soldiers who are supposed to assist, who are nurses. They only work 4 hours a day. So them being here, it's really not assisting. It has no impact. It's not even assisting the current crisis that we have there. They work 4 hours. They work in one department. They don't specialize in anything. So we feel that department needs to come to the table with us and be genuine to say that, what are your members' challenges, so that they know when they intervene where the intervention is needed.
And I know that you've been quite up in arms since the beginning of the lockdown and, since this whole pandemic. Can you just remind us, what are some of the issues that you have been tabling or you have been protesting over? And also, do you feel like the department is gradually trying to bring solution to some of those problems?
Hey, it's bad. It's bad because everyone is saying it, that the department is collapsing. There is weak leadership. There's weak leadership from the province to the level of the metro. You've got management that wants to be. They will want to reduce the challenges. They feel like when we at some point we were accused to say that NEHAWU is politicking. They must just assist. And at some point, the national leadership took a decision to say that our members are dying, our members are getting infected. They came to Metro, even nationally, to donate some PPEs, some immune boosters, to show that we really want to assist. But as a union, we can only do so much. We know that even our national leadership is struggling to get to sit with the minister. So the challenges that our members are facing is that you will find out that as much as there is PPE, the way it is distributed, there is this myth that full PPE must be given to doctors and nurses. But you expect the room that is having someone who's got COVID to be cleaned by a general assistant, and they are not given proper PPE. They will be given a mask, gloves, and apron. And that is why now you've got a situation whereby prior COVID, for example, here at Livingston, there has been a great challenge of shortage of staff, 100 and something. And when COVID came, that challenge was not addressed. You've got members who are testing positive. Now when they test positive, they are expected to go in isolation. Now that challenge that has been there, it becomes worse. That's why you have been observing here that hospital at times, it will be very dirty, not necessarily because workers are not doing their job, but they can only do so much because you'll find out that in a department that's supposed to have 10 people, there are 3 people because other people have left the system through death, others have resigned, others have got promotions. Now with COVID, on those 3, 2 will be infected. There is 1 person who is expected to do a job of the entire department. So those are the things that we're experiencing. Also another challenge whereby you will find out that service providers are even scared. They don't come here to pick up the dirty linen and all that stuff. So those are the challenges that we're having, whereby also our members are dying. And when we zoom in, the members that are dying, they are people who are chronic. And the Department of Health, it is bad that they are not complying in terms of regulations, because the regulations are very clear that people who are 60 and above, there must be risk assessment, that you don't expose them because they are high risk. But Department of Health has not been doing that. They have been failing. Hence, you've got a number of workers who are dying, who are getting infected. So it's really bad. Those are the issues that we have been struggling with. And as I've said, we've got a weak administration in the Eastern Cape. For example, here at Livingston, there is no CEO here. There is no CEO here. No one is accounting for anything. You can have a worker who doesn't come to work, no one will know. No one wants to take accountability, and all those things lies in the desk of the SG. Hence, as a union, we are saying that SG and the MEC, they must leave. They are collapsing the system. They are not assisting us. Instead of they are doing a blame game. They don't want to come and assist with us. We are bringing challenges, and we're not exposing them. When we are doing these interviews, our expectation is that they will come here to say that this was reported, take us through, so that they can address those things, but they don't do that. So those are the challenges that are faced by our members in Metro.
Well, thank you so much, Sisi. Well, that was Sweetness Sitoko saying that the Eastern Cape Department of Health is indeed in a dire crisis, outlining or highlighting some of the key issues that they have been fighting for since the beginning of the lockdown or the beginning of this pandemic, saying that they haven't seen much change in terms of things like PPE or additional PPE, stating that even the doctors or additional doctors that have been flown in from the military are not doing much, and that the 16 doctors are only working 4-hour shifts, which does not do much relief to the staff members. She says that the situation here is very dire, and she feels like the state, basically the department, is debilitating and in a terrible state. But right now, from myself and Nqonji and colleague Gobani Bloom, it's back to you in studio.